Picture this. You're sitting in your doctor's office, the air feels heavy, and you hear the words no man ever wants to hear. You have prostate cancer. Your heart races, your mind floods with questions, and almost immediately you're faced with a choice that feels impossible. Do you watch and wait, trusting regular checkups to keep you safe? Or do you fight aggressively with surgery or radiation to cut out the problem before it grows? Both paths carry promise. Both carry risk. And for men over 60, the answer isn't always clear. In today's video, we're diving into this critical decision: active surveillance versus aggressive treatment. We'll explore what each path really means, who benefits the most, and how seniors can weigh quality of life against the instinct to fight hard. This isn't just about medical facts. It's about your peace of mind, your future, and the life you want to keep living. So here's what we'll cover together. First, we'll understand why prostate cancer in seniors behaves so differently than many other cancers. Then, we'll break down active surveillance, what it is, who it's for, and why many men actually thrive with this approach. Next, we'll examine aggressive treatments like surgery and radiation, their benefits, and the trade-offs they demand. After that, we'll put them side by side, comparing risks, outcomes, and quality of life. And finally, we'll walk through a simple decision-making framework you can use with your doctor, so you never feel lost in the process. But before we can compare options, we need to start with the foundation: understanding what prostate cancer really is, how it behaves in older men, and why it doesn't always follow the rules of other cancers, because knowledge is the first step toward confidence. Act 1. Understanding prostate cancer in seniors. When most people hear the word cancer, they immediately think of something fast, dangerous, and life-threatening. And while that's true for many cancers, prostate cancer plays by different rules, especially for men in their 60s, 70s, and beyond. In fact, doctors often say that more men die with prostate cancer than from it. That's because in many cases, this disease can grow so slowly that it never causes major problems. But not always, and that's where the challenge lies. How common is prostate cancer in older men? Prostate cancer is one of the most common cancers in men. By the time a man reaches 65, his odds of having some level of prostate cancer, whether diagnosed or not, are surprisingly high. The prostate itself is a small gland, about the size of a walnut. But as men age, changes in hormones and cell growth can trigger the development of cancerous cells. For some men, these cells stay quiet, barely moving. For others, they grow and spread in ways that demand attention. Aggressive versus slow-growing cancers. Here's the critical difference. Some prostate cancers are aggressive, growing quickly and spreading to bones or lymph nodes if left untreated. Others are indolent, meaning they grow so slowly that a man might live the rest of his life without ever feeling a symptom. But not always, and that's where the challenge lies. Why age matters. For seniors, age is not just a number, it's a crucial part of the decision-making process. If you're 65, active, and expect to live decades longer, an aggressive cancer might mean aggressive treatment. If you're 80 with other health issues, a slow-growing cancer might never affect you, and treatment could cause more harm than good. That's why doctors don't just look at the cancer, they look at you, your health, your lifestyle, and your life expectancy. The emotional weight of a diagnosis. Still, let's be honest, hearing the word cancer is terrifying, no matter what your age. Many men describe the moment of diagnosis as a tidal wave of fear, followed by confusion. Do I need surgery right away? Am I safe to wait? Will this shorten my life? These questions don't just affect the patient. Wives, partners, and families often feel just as anxious. That emotional weight is one reason why many men lean toward aggressive treatment, even when the cancer might not demand it. Why this understanding matters. By truly understanding prostate cancer in seniors, its variability, its pace, and its risks, you're already better equipped to make smart decisions. Instead of reacting to the word cancer with panic, you can respond with perspective. And that's where the two main paths come in: active surveillance and aggressive treatment. Each has its strengths, each has its weaknesses, and each can be the right choice depending on the man. So let's begin with active surveillance: what it is, how it works, and why, for many seniors, it can be the smartest choice they ever make.
Act 2. Active Surveillance Explained. When men first hear the phrase active surveillance, many imagine doing nothing, just waiting for the cancer to get worse. But that's not what it means at all. Active surveillance is not about ignoring cancer. It's about keeping a close eye on it, knowing that sometimes the smartest move is not to rush into treatment, but to watch carefully and act only if the cancer changes. What is active surveillance? Active surveillance means your doctor tracks the cancer over time instead of treating it immediately. This involves regular PSA blood tests to monitor prostate-specific antigen levels, digital rectal exams to check for changes in the prostate, imaging tests like MRI when needed, biopsies every year or two to see if the cancer cells are becoming more aggressive. Think of it as checking the weather forecast every day before deciding whether to bring an umbrella. Most days, you may not need it, but if the storm clouds appear, you'll be ready. Who is active surveillance for? Active surveillance is most often recommended for men with low-risk prostate cancer, cancers that look calm under the microscope and grow very slowly, seniors in their late 60s, 70s, or 80s, especially if they have other health issues that make surgery or radiation risky, men who value maintaining their current quality of life over jumping into treatment with side effects. For these men, aggressive treatment may bring more harm than benefit. Surveillance allows them to avoid those risks unless they truly need intervention. The advantages: why choose active surveillance? Preserves quality of life. No surgery, no radiation, no immediate side effects. Avoids overtreatment. Many men live out their years without cancer ever becoming a threat. Gives peace of mind with safety net. Regular monitoring means if the cancer does change, it can still be treated in time. One patient once told me, "It's like knowing the fire alarm is always on. I can sleep at night because I know if there's smoke, we'll act." The challenges. Of course, it's not all easy. Emotional stress. Living with the word cancer in your medical chart can feel heavy. Some men feel anxious at every checkup. Commitment to follow-ups. Active surveillance only works if you stick to the schedule. Missing tests can mean missing warning signs. Risk of progression. In a small percentage of men, the cancer can become more aggressive over time. That's why vigilance is critical. It's not for everyone, but for many older men, these risks are outweighed by the benefits. Take the story of Robert, age 74. He was diagnosed with very low-risk prostate cancer. At first, the word cancer terrified him. He told his wife, "I just want it out." But after a long talk with his doctor, he realized surgery could leave him with incontinence or loss of intimacy. Instead, he chose active surveillance. 2 years later, his PSA remains stable. His biopsies show no changes, and he still enjoys gardening, golf, and weekends with his grandchildren with no side effects holding him back. For Robert, doing less was actually living more. Active surveillance versus doing nothing. It's important to understand, active surveillance is not neglect. It's not wishful thinking. It's a strategy, one backed by decades of research showing that for many older men, watching carefully is as safe as treating right away. It's the difference between ignoring a problem and managing it wisely. Still, not all prostate cancers behave gently. Some grow faster, demand more attention, and carry higher risks. That's when aggressive treatment enters the picture. So let's now explore what surgery, radiation, and other therapies can offer, and the trade-offs that come with them.
Act 3. Aggressive treatment options. For some men, the idea of living with cancer, even a slow-growing one, feels unbearable. They want it gone. Others don't have a choice. Their cancer is more aggressive, and delaying treatment could allow it to spread. That's when doctors talk about aggressive treatments, therapies designed to remove or destroy cancer cells, sometimes with the goal of cure. Surgery. Radical prostatectomy. One of the most common aggressive treatments is surgery, specifically a radical prostatectomy, where the prostate gland is removed entirely. The benefits? For men with localized cancer, surgery can be curative. It provides peace of mind because the prostate is gone, and the cancer is, in many cases, removed with it. But the risks are real. Surgery can lead to urinary incontinence, meaning leakage or difficulty controlling urination, sexual side effects, such as erectile dysfunction or changes in orgasm, and several weeks of recovery time, which can be challenging for older men. Still, for many, the trade-off is worth it, especially if they're younger seniors, in good health, and expected to live many more years. Radiation therapy. Another option is radiation. Instead of removing the prostate, radiation uses high-energy beams to kill cancer cells. This can be done externally through a machine targeting the prostate, or internally with radioactive seeds placed directly inside the gland, what's called brachytherapy. Radiation often offers outcomes similar to surgery, but with fewer hospital risks. However, side effects can include irritation of the bladder or rectum, fatigue during treatment, and gradual sexual side effects, which may appear months or years later. Hormone therapy. In some cases, doctors recommend hormone therapy, medications that lower testosterone, the hormone that fuels prostate cancer growth. This isn't usually a cure, but it can slow or shrink cancer, often used alongside radiation or for advanced cases. The downside? Side effects like hot flashes, weight gain, fatigue, and sometimes changes in mood or bone strength. For older men, hormone therapy can feel a bit like trading one burden for another. The psychological benefit. One of the biggest reasons men choose aggressive treatment is psychological. Removing or destroying the prostate gives many men peace of mind. They no longer feel like they're living with a ticking time bomb. Even if the treatment brings side effects, some men prefer certainty over the anxiety of constant monitoring. A patient story. Choosing to fight. Consider James, 66 years old, a retired police officer. His biopsy showed a more aggressive form of prostate cancer. His doctor explained that active surveillance wasn't safe. The cancer could spread. James chose surgery. Recovery was tough. He spent weeks with a catheter and months regaining urinary control. But a year later, his PSA is undetectable. He says, "I'd rather face recovery than live in fear." For James, fighting hard was the right decision. The trade-offs? So what's the reality? Aggressive treatment can save lives, especially in men with higher-risk cancer or those expected to live decades longer. But it comes at a cost. Side effects, hospital time, and sometimes permanent changes to quality of life. That's why the decision isn't simple. It's not just about treating cancer, it's about treating the whole man, his health, his values, his priorities. So now we've seen both paths, active surveillance and aggressive treatment. But how do they really compare side by side? And how can a man decide which path truly fits his life? Let's put them head to head.
Act 4. Side-by-side comparison. Now that we've explored both options individually, let's step back and look at the bigger picture. Active surveillance and aggressive treatment aren't enemies. They're different tools designed for different men at different times. The question isn't which one is better overall, it's which one is smarter for you. Effectiveness and cancer control. Active surveillance works best for low-risk cancers that may never spread or cause harm. The cancer is carefully monitored, and if it changes, treatment begins. Aggressive treatment, aimed at removing or destroying the cancer right away, offering peace of mind, and for many, a potential cure. Think of it this way. Active surveillance is like watching a small fire under control, ready to call the firefighters if it spreads. Aggressive treatment is like pouring water on the fire immediately, even if it might have burnt out on its own. Impact on quality of life. Active surveillance preserves daily living without treatment side effects. No surgery, no radiation. But some men feel anxious knowing the cancer is still inside them. Aggressive treatment removes uncertainty but may bring permanent changes, urinary leakage, sexual dysfunction, or fatigue. Here the trade-off is clear: quality of life today versus the assurance of long-term control. Risks and side effects. Active surveillance. Risk of cancer progression if not monitored closely. Emotional burden of living with a diagnosis. Aggressive treatment. Physical risks, bleeding, infections, long recovery, side effects like incontinence or erectile dysfunction. Neither path is risk-free. It's about deciding which risks you're more comfortable carrying. Emotional impact. Active surveillance. Some men feel relief avoiding unnecessary treatment, others feel constant worry. Aggressive treatment, many feel empowered by taking action, but later struggle with side effects. This is where personality matters. Are you the kind of man who can sleep soundly knowing the cancer is being monitored? Or do you only feel peace when you know it's been actively treated? Suitability by age and health. Active surveillance, ideal for older men with other health issues or for cancers unlikely to cause problems in their lifetime. Aggressive treatment, better for younger seniors in strong health or for higher risk cancers that could shorten life expectancy if untreated. Let's put it into a simple chart. Active surveillance, no immediate treatment, fewer side effects, requires regular monitoring, best for low-risk cancers. Aggressive treatment, surgery or radiation, higher side effects, long recovery, but potentially curative for aggressive cancers. Take George and Alan, two men in their early 70s. George's cancer was low risk. He chose active surveillance. 10 years later, he's still healthy, never needed treatment, and has no side effects. Alan's cancer was more aggressive. He chose surgery. The recovery was difficult, but his cancer was removed, and he now feels reassured he made the right call. Neither man was wrong. They simply made choices that fit their cancer and their lives. In the end, it's not about choosing the best option. It's about choosing the option that matches your cancer's behavior, your age, your health, and your priorities. Active surveillance and aggressive treatment aren't opposites. They are two paths to the same goal: living longer and living better. But here's the key question: how do you decide which path is right for you? That's where your doctor comes in, and how you approach the conversation can make all the difference. So in the next section, I'll give you the exact framework and questions to guide that life-changing discussion.
Act 5. Making the decision with your doctor. Deciding between active surveillance and aggressive treatment is not a decision you should face alone. Your doctor isn't just there to give test results, they're your partner in this process. But the truth is, the best decisions don't come from simply listening to your doctor. They come from a conversation, one where you bring your priorities, your questions, and your values to the table. Step 1. Know your priorities before you go. Before your appointment, take a pen and write down what matters most to you. Do you care more about avoiding side effects and protecting intimacy? Or is peace of mind more important, even if it means recovery and lifestyle changes?
Do you value quality of life today more, or are you focused on adding more years to your future? This clarity helps guide your doctor and keeps you from being swept away by medical jargon. Step 2. Ask about cancer risk level. Not all prostate cancers are the same. Ask your doctor, what risk category is my cancer? Low, intermediate, or high? Based on my biopsy and PSA, how aggressive does it look? If your cancer is low risk, active surveillance may be safe. If it's high risk, aggressive treatment may be the wiser path. Knowing your risk level is the foundation of your decision. Step 3. Understand the treatment timeline. Ask your doctor, if I choose surveillance, how often will I need PSA tests, biopsies, or MRIs? Then ask, if I choose treatment, how long will recovery take and what will I be able to do or not do during that time? For some men, a quick return to daily life is the top priority. For others, long-term durability matters more. Laying out the timeline in black and white makes the choice clearer. Step 4. Be honest about intimacy and side effects. This is a sensitive topic, but it's also one of the most important. Ask your doctor directly, how likely is it that I'll experience incontinence or erectile dysfunction with this treatment? How often do your patients experience these side effects? Every man deserves honesty, and you should never feel ashamed to ask. Your quality of life is just as important as your length of life. Step 5. Get a second opinion. Never be afraid to seek a second opinion. Another doctor may explain things differently, offer new insights, or confirm what you've already heard. Prostate cancer decisions aren't made in a rush. You deserve time and confidence before choosing. Step 6. Involve your loved ones. These choices affect not just you, but your family. Bring your spouse, partner, or adult children into the conversation. They may hear things you miss, and they'll help support you no matter which path you choose. Step 7. The decision framework. So here's a simple decision framework to take with you. 1. Define your priorities. 2. Ask about your cancer's risk level. 3. Understand timelines for both options. 4. Talk honestly about intimacy and side effects. 5. Consider second opinions. 6. Involve loved ones. When you follow these steps, the choice often becomes clearer. It transforms from an overwhelming dilemma into a thoughtful, informed decision. Take Richard, 70, diagnosed with low-risk cancer. At first he panicked and wanted surgery. But after sitting down with his wife and writing out his priorities, preserving intimacy, avoiding hospital stays, and keeping energy for travel, he realized active surveillance fit him best. 2 years later, his PSA remained stable, and he says the framework helped him make the smartest choice of his life. In the end, there is no single correct choice. The smarter choice is the one that aligns your cancer's reality with your personal values. And that only happens when you walk into the doctor's office prepared, informed, and ready to speak up. Now you may be wondering about the future. Are treatments changing? Are there breakthroughs that could make this decision easier for the next generation? Let's take a look at where prostate cancer care is headed and why there's real hope on the horizon.
Act 6. Hope, Research, and the Future. Prostate cancer is not the same diagnosis it was 30 years ago. Back then, treatment options were limited, and many men faced harsh side effects with few alternatives. Today, we live in a different world, one where technology, research, and personalized medicine are reshaping the journey for seniors. Better diagnostics. One of the biggest advances is in diagnosis. New imaging techniques like MRI fusion biopsies allow doctors to see the prostate more clearly and target suspicious areas with precision. This means fewer unnecessary biopsies, fewer false alarms, and a clearer picture of whether a cancer is truly aggressive or slow-growing. Genetic testing is also helping. By analyzing the DNA of prostate tumors, doctors can now predict which cancers are more likely to grow quickly. This gives patients confidence when choosing between active surveillance and treatment. Improved treatments. Treatments themselves are becoming safer and more precise. Robotic surgery now allows for smaller incisions, faster recovery, and greater precision in preserving urinary and sexual function. Advanced radiation techniques like proton therapy and stereotactic body radiation can target tumors while sparing surrounding tissues. Focal therapies such as cryotherapy, freezing, and high-intensity focused ultrasound, HIFU, are being studied as middle ground options, treating only the cancerous area, not the entire prostate. A future of personalization. The future of prostate cancer care is personalized treatment. Instead of a one-size-fits-all approach, doctors are using risk scores, genetic markers, and lifestyle factors to tailor care. For some men, this means more confidence in choosing active surveillance. For others, it means more effective, less invasive, aggressive treatments. The role of research and hope. Every year, clinical trials are testing new drugs, new procedures, and new ways of supporting patients emotionally as well as physically. And survival rates continue to improve, especially for men who detect prostate cancer early and take time to make informed decisions. Reassurance for seniors. So, if you've just been diagnosed, know this: you're not facing the same limited choices your father or grandfather once did. You're living in a time of progress where options are safer, smarter, and more tailored to you than ever before. And perhaps most importantly, a diagnosis of prostate cancer today is not an automatic sentence. It's the start of a conversation and a chance to take control of your health with more hope than ever before. And that brings us to our final thoughts. No matter which option you lean toward, watching carefully or fighting hard, your decision deserves respect, courage, and encouragement. Let's close with a message of strength and reassurance.
Gentlemen, we've traveled a long road together today. We've talked about active surveillance, the watchful waiting that protects you from unnecessary treatment, and we've explored aggressive options like surgery and radiation that can bring peace of mind to those facing higher risks. Both paths carry their weight. Both paths require courage, and both paths can lead to a meaningful, healthy life after diagnosis. Respecting every choice. There is no single right answer. What is smart for one man may not be smart for another. A 62-year-old still working full-time and planning adventures may choose treatment to secure peace of mind. An 80-year-old with slow-growing cancer may choose active surveillance, confident that he can live fully without the side effects of surgery or radiation. Both men are making wise, informed decisions because they're choosing based on their lives, their values, and their health. That's what matters most. The power of partnership. Never forget, you don't walk this path alone. Your doctor is not just a technician, they are your partner, your guide, and your advocate. Bring your questions, share your fears, speak openly about what matters most to you, whether it's intimacy, energy, longevity, or simply comfort. The best medical care always happens when doctor and patient make decisions together. Words of reassurance. Please hear this clearly. A prostate cancer diagnosis is not the end of your story. For many men, it's just a new chapter, one filled with opportunities to live smarter, healthier, and with deeper appreciation for every day. I've seen men choose active surveillance and thrive for years without problems. I've also seen others go through treatment and come out stronger, grateful they took action.
What they all share is the courage to face their diagnosis with clarity and determination. Encouragement for viewers. So, if you are watching this and feeling overwhelmed, take a deep breath. Remind yourself, you have options. You have time to make the choice that fits you. And you have a community here at Men's Vital Health standing beside you with knowledge, compassion, and encouragement. If today's conversation brought you clarity, hope, or comfort, please give this video a thumbs up, share it with someone who might need it, and subscribe for more guidance from Dr. Emily Carter. And in the comments below, tell us, would you lean toward active surveillance or would you choose treatment right away? Your voice may help another man make his decision. Remember, friends, life after 60 is not about giving up. It's about getting wiser. Whether you choose to watch and wait or to fight head-on, the smartest choice is the one that honors your health, your values, and your future. This is Men's Vital Health. I'm Dr. Emily Carter. Until next time, stay strong, stay informed, and live your life with courage.